We might need the feedback, Mark, just so we hear that. There we go.
Good evening, everyone, and welcome to the special radio show with Dr. Doug Thompson. With over 25 years' experience in state-of-the-art oral health, he's here with us talking about the serious connection between gum disease and most of the major diseases of our time. Dr. Thompson will tell us about where his research has led him with respect to avoiding these silent killers. He's joining us tonight in this rare opportunity to call in and speak with the doctor directly. So don't miss what Dr. Thompson has to say. And if you have a question for the doctor, we're inviting you to call at 800-859-0957. So stay tuned and we'll be right back after this short break. You're listening to 760 WJR.
Okay, we're on Facebook Live.
Welcome to Facebook, Siobhan.
Welcome.
Dr. Thompson.
Thank you. Yeah, thanks for the
Welcome.
Nice thank you.
And-
Thanks for the nice intro.
And, well, yeah, I mean, it's saying what's true and letting the people know that they need to get to know you and get to know more about what you do. But seriously, I know we're on Facebook and we haven't gone into the first section,
Yeah.
but I'd like to at least introduce the listeners to all the other things you're doing. You know, knowing that you've got a specialty in prevention and you're one of a few people, the few doctors that do it. I still also think, like Joe, who's here with us tonight, said that, what about all the other stuff you're doing?
Yeah, and it's true because sometimes people will come into the office and they'll say to me, "Oh, I didn't," or I'll approach them and I'll say, "Wow, your teeth look amazing. I think they're brighter than the last time I saw them." And they said, "Yeah, I got my teeth bleached." And I said, "Well, we do that." They
Right.
said, "Well, we didn't know you do that." So,
Right.
so you're correct. I think that you should know that we're a full service restorative dental practice, and not even just a full service restorative dental practice. We're much more than that because I was a lab technician for 12 years before I became a dentist. So we have a full service. We have a full service dental lab on the premises, and so we can do a lot of customization of restorations, and we do a lot of full rehabilitative care, and we take severely broken down mouths and restore them to health. But the point is, even though you're doing the mechanical piece, you have to build that on a sound, healthy foundation. So patients need to be healthy in order to support that. So we're all about that great cosmetic look and that great aesthetic appearance, as Joe mentioned. But we have to make sure that we keep people healthy as well.
Yeah. Well, no doubt. We'll talk about that when we come back. And is our timer right over here?
Yeah, 7 minutes.
Yep.
Oh, there we go. Okay, gotcha. Welcome to the special live radio show where you can call in with your questions and talk to the doctor directly. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Doug Thompson, integrative oral health dentist from Bloomfield Hills, Michigan. He's here with us discussing his state-of-the-art clinic, the latest diagnostic tests in oral health care, and the importance of the connection between the mouth and many systemic diseases. If you have a question for the doctor on the matters we're discussing tonight, please call us at 800-859-0957. Dr. Thompson, always a pleasure having you back on air. There's so much to talk about, not only about your dental practice, which is a medical dental practice where you specialize in prevention, but tell the listeners, what else do you do?
Yeah, thank you so much for the warm introduction. There's no question that, we're really a regular, not even regular, but we're a little bit of a unique restorative dental practice. So not only do we focus on health and wellness for our patients that are sitting in the chair, but, patients come to us because they have appearance issues, they have issues with crooked teeth, they have issues with teeth missing, they have issues with teeth that are severely worn down from bite disease, and these people need to be re-restored. Well, one of the benefits and one of the advantages that we utilize in the practice is I was a crown and bridge technician. I worked in a dental lab since I was about 17 years old. So for the first 12 years of my life, I built crowns and bridges, customized crowns and bridges for patients. And so we've got really good knowledge and skills with ceramics and skills with implants and different types of things that we would do to help restore people to full functional health. Now, functional health is really important because that means the teeth have to work, they have to look good, they have to fit right in the face. But the other part that has to happen is we need to make sure that the foundation that we build those teeth on is healthy. And so I love to create beautiful smiles, but I want those people that we create those beautiful smiles for to be as healthy as they can be. And that's where the wellness piece kind of comes in. So we do all of those traditional services. And so don't ever overlook us. And, a funny story, and it's not so funny because it kind of reminds us how we have to remind our patient population what we do. But I had somebody who came in and I saw her on regular routine examination. And I said, boy, your teeth look fantastic. What did you do? And she said, well, I bleached them. And I said, well, we didn't bleach them. And she said, well, yeah, I went to a bleaching center and had them bleached. Well, I said, well, we do that. She says, well, I didn't know you did that. So
Right.
the idea is we do get really caught up and I know this show is really focused on the medical side of the practice, but I do want our listening audience to know that we do full service dentistry and we're happy to take care of people in that regard as well.
And
I'll
just-
jump in there, not to speak on top of you, but I know of a lot of people that will, and I want to emphasize the importance of the wellness inside the mouth before the cosmetics too, because I've known of a lot of people that will go to like a different country and get their whole mouth redone, and there's no analysis of what's going on, underlying disease, what's going on with the gums. So that's an extremely important thing because, you can go somewhere and get the cosmetics taken care of, but you're putting it on top of an unhealthy mouth.
Yeah, no question. And I spent literally an hour and a half with one of our fellow WJR listeners today, and who has spent thousands of dollars taking care of his mouth with, but things were put in and there's multiple infections and there's multiple issues. So you're absolutely right, Siobhan. We have to really make sure that the foundation that we're building on is sound and solid. And because that issue, when you have a lot of infection and you have poor foundation, that can totally affect your systemic health, and it can affect your blood biomarkers. It can affect quite a few things. So we have the ability to determine who's at risk for that. And if you're at risk for that, then we're going to launch into some medical testing to make sure that you're going to be safe.
I just want to weigh in here a little bit because you did say, Dr. Thompson, you were talking about your experience in the clinic that you worked in when you were 17, building crowns and bridges. And I know that you mentioned on your Sunday show that people need to be aware of the ingredients that are going into those crowns and bridges.
Yeah.
Can you talk a little bit about that?
Yeah, well, one of the things that happened back in maybe in the late 80s was we started to really rely on manufacturing from around the world. And some of the standards, and, we have some of these themes about Buy American and, whatever. You get the idea. I don't want to get into a political rant, but what I would say is that manufacturing standards need to be really high. And you need to use really high quality materials and equipment. And when things happened back then, it opened the door for people to use materials that were
Substandard, would you say?
easier to acquire. And it became very enticing because as insurance companies tightened up and reimbursed less and less, it put pressure on dentists to do things cheaper. So I can tell you, we went the other way. We went into a direction of higher quality, better materials, and we only use the finest materials in our practice, and we can assure you of that. But that's a big problem in dentistry,
And
knowing where the stuff comes from.
And you're doing what's best. But another question in that regard is using let's say a substandard material in a crown or a bridge. How does that affect the consumer, the patient? Do they wear down faster? Do they break? Do they erode? Do you have problems with them?
All of the above. The ceramic debonds, the materials wear faster, things break more. The look is typically not as nice. So there's a myriad of things. Not to mention there can be some body contamination. One of the things that we're very cognizant of are pollutants that are in the body. So the big one in dentistry would be mercury, and so from amalgam fillings. Well, we stopped placing amalgam fillings years and years ago. But the idea is you do want to know what's in these materials, and you don't want to buy materials from a substandard supplier. That's for sure.
And it's good that you are buying the appropriate materials and the appropriate with the appropriate ingredients, because the consumer doesn't know. I mean, they go to
That's
their
correct.
dentist and they just trust the dentist. Let's
Correct.
come back and talk some more with Dr. Doug Thompson. You are listening to the Dr. Thompson radio show, and he is here tonight talking about the seriousness of undetected oral pathogens, which can be the root cause of many catastrophic diseases. If you have a question, you can call us at 800-859-0957. Again, that number is 800-859-0957. You won't want to miss this opportunity to talk to the doctor directly. You're listening to the Dr. Thompson radio show on 760 WJR.
And we're back on Facebook
We're back
now.
on
Yep.
Facebook.
Yeah, I'd love to get some questions from some of our Facebook audience listeners. I don't know if people, I don't know, people probably have questions, and I would love to field some of those questions. There's so many cool things to talk about, and I'd love to take the show in a direction that the audience wants to go.
Right.
Yeah.
So if that's a possibility, we'd love to have somebody have the courage to ask us a couple questions.
Okay. Yeah,
And-
hopefully some people will pipe in and speak up.
Yeah, and the interesting comments about that we made on the air about the other services that we do, it can really be overlooked. However, the practice doesn't feel like it has a big medical component, but it doesn't feel like that dominates. We've really woven that into the culture of the practice. So we can have aesthetic consultations, we can have implant restoration consultations, we can have all of that. But what happens is it's not a separate entity. It just becomes part of how we live and what we do and what we talk about. So all of our patients, no matter what we're doing for you, if we're doing a crown for you, or we're doing a filling for you, or we're doing Invisalign for you, we're always concerned about your health. And if you walk through the hallways of our practice, you'll hear our periodontal therapists, you hear our assistants like Joe, and our budding hygienists like Joe. You'll hear these people talk about these issues. It's not just all about restorative dentistry, and it's really refreshing. So it changes the feel of the culture of the practice, and that's really nice.
And I think that, listeners and patients need to know that you are all encompassing. It's not just that you specialize in prevention and, identifying all these horrible diseases before they become a horrible disease. But the fact is you're doing all this other stuff. You're even doing cosmetic. I didn't even know you were doing cosmetic.
Yeah, there's no question about it. And we call that aesthetic dentistry, but cosmetic or aesthetic dentistry is really important. And, if you want to come back into this segment and talk about how significant things are to patients, how significant the look is to patients, we could talk about the psychosocial impact of teenagers and young high school students that have missing teeth or malformed teeth or misshaped teeth.
Sure.
It's the peer pressure. It's immense. We have a big problem right now with our teens, and there's a lot of depression and there's a lot of issues, and part of that it has to do with how they come across and how they appear to others.
Mm-hmm. We did have a caller come in, so I don't know if you want to start with that.
Sure.
Karen in Northville.
We'll take it. We'll take that first. There you go. There's the spot running.
It'd be awesome if that was in French.
I can do it in French for you. No
I'm
worries.
just kidding.
Bienvenue. Welcome back to the Dr. Doug Thompson live medical radio show here on WJR. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Thompson, general dentist and oral health specialist in Bloomfield Hills, Michigan. He's with us discussing the latest diagnostic methods he uses to diagnose many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctor, please call us at 800-859-0957. Dr. Thompson, you mentioned many things over the break, and we are on Facebook Live. If anybody cares to tune in to the Facebook part of the show, we'll come back and talk some more about the things we talked about on the break. But Siobhan, in the meantime, as a caller.
Yeah, we do. We have Karen on the line in Northville. Karen, what's your question?
Yes. First of all, thank you, Dr. Thompson, for what you do. Wonderful. And I just think that oral health is not something that people really think about. It's more cosmetic. And so thank you.
Thank you for the kind comments, Karen. Go on with your question.
I am an adult who has had TMJ problems her whole life, never orthodontia, and I recently finished a year of Invisalign, which is the brand name, with my dentist. And things are great, but my chiropractor said, how can you put plastic in your mouth every single day? And I'm very conscientious about my health, and it never dawned on me that it was something that could leach into my body. I don't have any amalgam fillings. I had those removed years ago, and now I'm a little bit freaked out. So I was wondering if you could speak about maybe the plastics in that, and that's it. So thank you.
Yeah, you're welcome, Karen. You know, the companies that are making these products and the plastic that's used in the let's just say the aligner business. I don't want to name any one company because there's several of them, but they're very cognizant of the pollutants that are in plastics, just like the companies that are making water bottles. You know, they've gotten very, very savvy about BPA free and safe water bottles. And there was a big conflict about if your water bottle freezes or heats up in your car, should you drink the water because maybe there's something leaching out of the plastic, and it just hasn't proven to be true. So the idea is these plastics, even though they are plastics, they're made very safely. I believe that they're mostly pollutant free, and if they're made by a quality company. So this is exactly what we were talking about on Facebook Live before we come back to this live issue: is where do dentists get their materials from? And it's incumbent on us to make sure that we use companies that provide materials that are safe for you. So I would really want to calm your fears about the plastic that's been used in that process. And that plastic's very sophisticated type plastic. It has memory. In other words, the computer generates where your tooth wants to go, and that plastic has to move your teeth there. And that's just not some typical plastic. It's a very sophisticated process. It's very scientifically oriented, and I think it's very safe. So I would just, I would tell your, I would just suggest to your chiropractor, if he or she wants to do more research in that, that's great, but that's not your average plastic. I mean, that's a very sophisticated process. And there was a time when the aligner business, the plastic aligners that are used to organize the teeth, there was a time when we thought it was a joke. And really, today, it's amazing how many people can wear clear braces and move the teeth in a way that they used to do only with wires and metal braces. So it's really a gift, and I hope that the aesthetic outcome is what you were hoping for. And I would tell you not to worry. I don't think it affected your health in a negative way at all.
Well, Karen, thanks for calling, and that was a wonderful answer you just gave that caller. Coming back to some of the other things that you do in your office, let's come back and talk more about, other than being a specialist in prevention, you're doing general dentistry, you're doing a lot of other things, and you're doing implants. And certainly we've talked about those. You're using the best materials, which is very, very important. And you also do cosmetic. So tell us a little bit about some of the other things you're doing in the office.
We do. I mean, I do want to say one thing about the cosmetic component, and that is one of the populations that I think is really a little bit underserved by some parents are the teenage group that have either malformed, mal-shaped, or missing teeth. And I don't think we really understand or take seriously enough the psychosocial pressure that's on some of these kids when they have to come to school with a flipper, or they have to come to school. You know, that's a tooth that you can take out and show your friends, and it's kind of cute in the locker room, but it's not so cute on a date.
I'm glad
So,
you explained what that
yeah,
was. I
yeah.
wondered what you meant
Yeah,
by a
it's
flipper.
it's not a dolphin.
Okay, I was
you know,
thinking, I was
yeah.
wondering about that.
Yeah,
Okay.
yeah, that's maybe dates us a little bit, but the idea is this is not something that is really cute, and so it can really have a big social impact on acceptance and peer pressure. And we know a lot of our children are suffering right now from how they fit in, and if you have issues with the teeth and issues with the way that even the color of the teeth. We can help with that, and that's a really big thing. So before we move on from cosmetics and aesthetics, I really want to make sure I emphasize the psychosocial impact on the children
Very important. It's
and young
something,
adults.
I think it's something that probably a lot of parents don't think about. They just don't think about how important that is, that whole fitting in aspect and the,
Well, parents think about the expense, and so
well,
that's
sure.
right. Parents think about the expense, and sometimes that overrules what they can do. But I just want to make sure that we emphasize how critical it is, because I have children and young adults that cry in my chair, and I have consultations often. Anybody's under 18, we need a parent to give consent, and sometimes I have to take parents out of the room and say, "You have no idea how much this is impacting your daughter or your son." And I want to make you aware because it's serious.
hmm I know. I mean, it's a big responsibility, but I'm glad that you're taking that on your shoulders. We've got a couple of minutes left before we go to break. What else are you specializing in your clinic that people may not know about?
Yeah, the big thing that we're looking for, in addition to all the way the teeth come together and fit and the function of the teeth so they work properly, because you have to have great teeth to eat healthy foods. But what we want to make sure is that there's no condition in the mouth, no oral condition in the mouth, whether it's sleep apnea, whether it's gum disease, whether it's cavities. We want to make sure there's no condition that contributes to whole body inflammation. And I studied a little bit of integrative medicine some years ago, and back in 2012 and 2011, the big buzzword was inflammation. Inflammation is known as the silent killer. Well, one of the things that causes tremendous amount of whole body inflammation is either a root tip infection. That would be an infection that we would know commonly as like an abscess or a tooth that needs a root canal or a diseased tooth like that. A tooth end infection is seriously contributory to overall inflammation, but also gum disease is also very contributory, and so is sleep apnea. So a lot of our focus has been on tests or things we can recognize or things I can teach my team about that would identify areas where you might have excess inflammation that with only a little bit of knowledge or even something relatively simple, we could extinguish. The idea is, inflammation, we need to extinguish that and eliminate the body from inflammation because that's what ages us.
Hmm.
That's what ages us. So,
Well, also talking about, abscesses leading to inflammation or increasing inflammation in the body. What are the symptoms to the patient of the early beginning of an abscess? Do they have to wait until they're in pain and therefore they're
n-
they're in a mess or
yeah, it's often way too late by the time they wait. And as a matter of fact, one of our new patients today waited. He hadn't been to a dentist in 12 years. And so he started to have pain about a year ago, and now his tooth can barely be saved. It's going to be really, really hard. So the idea is in dentistry, one of the difficult things for us as dental care providers is many of these diseases don't hurt. That's why you need screening. You need to be screened.
right?
And I think every patient, every single patient should be screened and should be looked at very carefully. And that's why we do some basic, even salivary testing on our new patients, because we want to find out what is going on in the mouth that we can't see. Some of the stuff, Anne Marie, we just can't see. And so we need to be able to look for it or test for it or survey for it. Many of our inquiry attempts start with some basic questions, and I'd love to talk about that after the break.
We're definitely going to talk more about some of the diagnostic work you do on the other side of the break. In the meantime, you're listening to the Dr. Doug Thompson radio show, where talking about the importance of diagnosing and treating gum disease and how it can prevent some of the major diseases of our time. If you have a question, you should call the doctor directly here at 800-859-0957. Again, that number is 800-859-0957. Don't lose the opportunity to talk to the doctor directly. You're listening to the Dr. Thompson radio show on 760 WJR. How are
Okay.
things going on Facebook?
Yeah, pretty good. I mean, there's some people watching, no comments yet.
Okay. Are the Facebook Live listeners listening when we go back on the radio, or is that part shut down?
No, they hear the whole thing.
They
Yeah.
hear, they don't see it though.
They see it. Yeah.
they do.
So the whole
Okay.
thing is broadcast
Great.
on Facebook.
Oh, good.
Yeah.
Nice.
So they get the whole show.
Good.
Sure.
Because I just I haven't watched a lot of the Facebook Live presentations, so I didn't know what part they saw. What part they
Yeah.
didn't see.
No, they see everything. It's from
Okay.
start to finish, the whole
Okay,
thing.
great.
So
Mm-hmm. It should show up on your computer after, because that's what I do. I watch the show when I go home.
Yeah. Yep. I've seen it a couple times,
So
but
you
I
have,
couldn't remember if certain segments were cut out or not.
right. No, I think it's all there. So we ought to come back. I mean, we try to cover everything in the show, but we can't possibly cover everything. But I want to still come back to sleep apnea and its connection to cardiac disease, which is what, the number one or number two killer?
hmm
Still the
Big time. Yeah.
big time. And so it's so important. And I think that so many people feel as though the sleep apnea test and, still is going to hospital, spend the night, sleep there, get wired up, come home, get this mask, and if it doesn't work, they throw it away. I mean, I don't think we don't realize how many people go and have these tests when they could have this simple take home test that you have. And then what do you do with it once you get it back? And once you have the sleep apnea diagnosed, you're able to do some kind of mouth guard.
We
I
can.
think you really need to explain that, because there are a lot of people that would be more likely to go for a sleep apnea test if they thought that
Yeah, we can
there
talk
was
about that.
another solution.
Yep. We screen every single patient for sleep apnea. We ask some questions, and then if the questions are answered in a way that is suggestive, then we will do more. We'll collect more data and we'll do more.
Mm-hmm.
So not everybody gets a sleep study, but it's not a bad idea. And there's ways we can do it. And there's some really cool devices you can use on your phone now
Mm-hmm.
to
Yeah.
listen to what you sound like when you're sleeping. Many people don't know.
Mm-hmm.
I have people who sleep alone, and they're like, I don't really know, and the cat can't tell me.
Mm-hmm.
So
Mm-hmm.
how do I find out? So we can talk about that because I think it's interesting. And
Yeah, it's very
and we do
interesting.
a lot of it. I had 2 patients today that we were dealing with sleep apnea.
And I mean, the take-home test, the study itself, it's only a couple $100, right?
Yeah, it's about 275, and
Yeah, so it's under
yeah,
$300.
yeah.
So
Yeah.
It's easy.
Yeah, I did one recently. It was like you put a thing on your finger
That's
and
what you
then
do.
a chest thing,
Yeah.
like a little
Mhm.
sticky thing. I mean, very simple, and you just go to sleep, and your phone matches up with a PIN number, and
right,
it just logs it. You start your
Yep.
clock, and that's it.
how'd it turn out?
Well, I don't know. I haven't gotten the results yet. I mean, a
Okay.
doctor has to
No, it
interpret
turned
it.
out awesome. We know that already. We already know.
I mean,
know.
I'm still here, so it didn't
Yeah.
kill me. That's
Our
for sure. But what were the
CIMT,
results? We don't know.
our CIMT wasn't that
Well,
great.
it was not
so-
good. It was not good.
But it just goes to show you can't rely on how you look, right?
Yeah.
Looks don't speak for everything.
No, it's true. It's true.
So,
That part's true.
yeah, biggest mistake people make. They just think if they eat healthy, they're great. Exercise, go to the gym.
Yeah, and I think we mentioned it in one of the other shows, but we really shouldn't use the way our body looks as determining who's healthy or not. We really need to measure some of our metabolics, and so that's the idea. And it's because the other part will fool you for sure.
And then people also rely on age. They think that if you're in your 20s, there can be nothing wrong with me. I'm
Yeah.
invincible.
Not true.
Oh, no, absolutely. Welcome back to the special edition of the Dr. Thompson Radio Show. I'm your host, Anne-Marie Cronin, and we are talking with Dr. Thompson, dentist and pioneer in prevention from Bloomfield Hills, Michigan. He's here tonight explaining the medical diagnostic model he incorporates in his clinic to screen for many of the catastrophic diseases, from cardiac disease to Alzheimer's, that through early detection can be prevented. If you have a question for the doctor on the topics we're discussing tonight, please don't miss this chance to call us at 800-859-0957. Dr. Thompson, over the break and while we were on Facebook Live, we were talking about all of the other tests that you do. You were talking about inflammation. You were talking about abscesses leading to inflammation. I'd like to sort of switch over to cardiac disease, since you are a specialist in prevention, and the numbers speak for themselves about how many people die, drop dead from cardiac disease, or they're labeled, they have to suffer with it the rest of their lives. Now, let's talk about what you're doing with the sleep apnea test, which we know already is very seriously connected to cardiac disease.
Yeah, well, a couple things, Anne-Marie. One is not only the sleep apnea test, and I want to get to that, but the first thing that we look at is when we do thorough gum and bone exams on new patients, and this is literally happened today. We do a very thorough examination, a gum and bone examination, and if we have patients that have a lot of inflammation, or they have, we call it suppuration, but pus. If you have like a little pimple, you squeeze a pimple, white stuff comes out. If you have that around one of your teeth or one of your implants, we know that that's a major driver of inflammation.
Dr. Thompson, excuse me, just before you go any further, how do you do this gum and bone exam? It sounds interesting, but it sounds scary. How do you do it?
Yeah, and I don't want to intimidate anybody, but really it's done visually with our eyes, and then we take a small calibrated measuring instrument called a periodontal probe, and it's basically a tiny, small instrument about the size of a piece of thin spaghetti, and we would take that and we would gently insert it in the crevice between the tooth and the gum, and we measure that pocket. And what happens, we call that a pocket. And when we measure that, it's like an envelope. You open the envelope and you put the little spaghetti in there, and depending upon how deep it goes into the envelope, it could be really it could be really significant. And what I would like to your listening on our listening audience to think about is it's a lot like different fish live at different depths in the ocean. You don't expect a shark to be in 3 feet of water, but when you're in a lot deeper water, you could get some dangerous fish down there. Well,
Hmm.
that's what happens around our teeth. If that area gets deep or that area gets deeper, it selects or it's a perfect environment for bad acting bacteria to grow and bad acting things to grow. So we do this gum and bone exam. We measure all these pockets, and it becomes basically a graphic roadmap. It becomes a roadmap that we use, and we compare the charts to each other over a series of time, and we can tell you if your disease is stable or if your disease is progressing. And what we want to do is make sure everybody's disease is stable. So to the earlier point, if you have this condition going on where you have these deeper pockets, it selects for the wrong kind of bacteria. And what do we know about those bacteria? It affects the biology or it affects the health of our blood vessel walls, our blood vessels. So just think if I put something in your body that made your blood vessels really stiff, what that would do is it would drive up your blood pressure. Because just like a garden hose, if a garden hose
Right.
is really stiff, the blood pressure goes up high. But if the walls are really compliant and they stretch, then the force of that through the vessel is going to be less. So when I see warning signs that somebody could have some of these things going on, the first thing I want to do is measure some of the cardiovascular measurables to tell me how healthy are your blood vessels? What age are your blood vessels and what age are you? Is it the same or is it really different? And that's what, you alluded on Facebook Live to a CIMT test. That CIMT stands for carotid intima media thickness test. And we have, people who can do that for us. So let's now go to sleep apnea. If you have sleep apnea, what happens is you stop breathing for more than 10 seconds multiple times per night. And you might not know that. You might not know that because you're sleeping. So your partner in bed may know that because they hear you gasp, they hear you choke, they hear you stop breathing, they might be concerned for you, they might hear you snoring, you might get an elbow in the ribs. I mean, there's different things that happen that could alert you. But how do we really know what's happening? Because there's several things that we could measure. So what we have in practice is a very simple wristwatch type device with a finger probe that's very easy. That means you stick your finger into something that measures the oxygen in your finger, and we get a very detailed report about snoring, about how long you stop breathing, how many times you stop breathing. And if you went into a pool and you dove deep into the deep section and you went down underwater and touched the bottom, you'll be surprised how desperate you are for air even after 10 seconds. Most sleep apneics stop breathing for 10 seconds multiple times at night. So your brain, while you're sleeping, says, Anne Marie, wake up, wake up, wake up. And it puts you into a different alert system, and it's very stressful for your body. And it drives up your blood pressure. It causes problems with your cholesterol balance. It causes all kinds of medical problems. There's way too many. We could take 5 shows to discuss all the things that it affects. So what's the important concept? Figure out who you are and figure out if you have that or not. And if you do have that, you can address it very simply with either an oral appliance. You can, if it's very drastic, we can send you to a sleep specialist. There's different things we can do. The first thing is to be screened for it and identify it. It's under $300. It's simple to do. You do it in the comfort of your own bed. You do not have to go to a hospital. And it's really revealing. Everybody should have that test.
I think everyone should have it. That was a lot of information you gave in one
Yeah.
minute, and I just want to go over some of the points that you made. I think that because cardiac disease is so prolific, it's so silent of a killer, so undetected until it's too late. And that's the reason why I say all the time, everybody should line up and get this test. That being said, not everybody's doing the type of take-home test that you do. Yours is certainly state of the art. People don't have to go and spend the night in a clinic or in a bed with, and deal with masks. Yours is certainly a much better way to go. And the other thing I want to throw in there is that a lot of people don't, get the sleep apnea test because it's not covered by insurance. But my point is that doesn't matter. Your life is worth much more than the 200 and something dollars that you pay to do this take home test. And because of the high numbers of people that do have a connection between, and it's proven that the connection between sleep apnea and cardiac disease is very high. And so everybody should line up and get this test.
There's no question about it. And the biggest asset that all of us have, we think it's our home and we think it's our bank account. Well, I can tell you what it is. It's your ability to be healthy and go
Yeah.
and go make a living and continue to work and continue if you're in the working age. And if you're not in the working age and you've prepared beautifully for yourself and you're in some of those years where you can work a little less and enjoy life a little bit more, you want to enjoy life. You want to be with your loved ones. You want to be with people you care about, and you want to drive a car and eat, so we need to make sure that we have good cognition, we have good teeth and healthy teeth, and you want to look nice. So these are really important things, and being able to sleep well totally changes your health trajectory, and you shave years off your life if you're not sleeping well, and you're not sleeping well because of some anatomical issue or some breathing issue at night.
Well, certainly we tend to think of sleep apnea and cardiac disease as something that affects people that are beyond, let's say, their 20s or 30s. But I know that you've talked on other shows about the fact that there's pediatric sleep apnea. And who knew about that?
There's no question that any child that's making sleeping sounds, gasping, wheezing, snoring, choking, it's not cute. I sometimes on social media, someone will bring me a video of a child that's snoring and the parent thinks it's funny and they post it up on social media. I beg that parent to get that child some
Yeah.
help, and we make sure that we make sure that happens. We survey all the children for issues in the practice because pediatric sleep apnea is serious because it's the beginning of the rest of your life.
Yeah, and unfortunately, no one knows that it even exists. So pay attention, listeners, to this if you have young children. We're going to take a brief break. In the meantime, you're listening to the Dr. Douglas Thompson radio show, and we are talking about oral health and disease prevention. If you have a question, you can reach the doctor and talk to him directly at 800-859-0957. Again, that number is 800-859-0957. Don't miss this chance to talk to the doctor directly. You're listening to the Dr. Thompson radio show on 760 WJR. And we are
Yeah,
back
back on Facebook.
Facebook.
So any of the sleep apnea, the sleep apnea discovery is fantastic. And now, interestingly, Karen's question from Northville about plastic and plastic toxicity,
Mhm.
even the sleep appliance business is the sleep appliance manufacturers are very much aware that certain plastics haven't been so healthy, and so we have antimicrobial sleep devices that can be used now for sleep apnea. So
Wow.
it's amazing. It's
I
amazing.
didn't even think about that. And I always think about plastic with water bottles and stuff,
Yeah.
any of those things. But yeah, thinking about the teeth straighteners or
Yep.
anything that you put in there, I didn't even think about that. So it's an interesting point.
Yeah, no, it's a valid point because there was a time when it wasn't that way. It wasn't as healthy as it is now.
Sure.
So it was good. It was a good question, and it had good merit. So I appreciate the question. But the sleep apnea and the appliances, the people that wear the appliances successfully and get a good night's sleep from them, they will never give them up. I mean, so
Mhm.
very often I'll ask somebody, I say, can I have your sleep appliance and keep it overnight for a couple nights? And I would just maybe even joke a little bit, say, I want to repair it or really clean it or whatever. No, you can't have that thing.
Yeah,
It's
what does it look like?
it,
That's another thing we need to talk about.
yeah, it's basically it looks like some Invisalign appliances. If you've seen that, they're clear aligners. They fit very clearly over the teeth. They're a little bit thicker, but then they have some kind of mechanism to push your lower jaw more forward. That's usually what happens at night, is trying to move your jaw into a more forward position. And we can talk about it when we come back because it's the difference between if you took a coffee stirrer and tried to block your nose and take a coffee stirrer and put it in your mouth and try to breathe through it versus breathing through a small straw, you would realize that breathing through the small straw is so much easier. So sometimes we don't have to relieve the airway by much to make a
Mhm.
huge difference in the ability to get air.
Or
Hmm.
just any difference at all. And when you brought up the pediatric sleep apnea, I was thinking about the fact that most parents put their kids in a room at night and close the door. And they might have one of these like baby monitors
Oh
in
yeah.
there. But a lot of them, once the kid gets 2, 3, whatever, they're in a room by themselves. So how's a parent ever going to find out?
Yeah, no, we encourage parents to take a video of the child sleeping, and we very tastefully want to just evaluate for sleep apnea. So sometimes there's cameras you can put in the room for them, so you can just watch them how they sleep. Even positional, even what position they're in is a big issue.
And I think that, a lot of people just think that the only thing out there, well, first of all, they don't even get the connection. But I think the next thing is that they think about, the apparatus, that staying in the hospital overnight or clinic overnight and this big mask. That's what happened to my daughter. She threw it out. She went through it for so many months. She said, I'm done with this. I'm just done. It's too cumbersome, too odd, too bad. No, the other daughter. No, this one hasn't had
Yeah,
one.
not
She
the.
had the she
Little
had the
clarification.
she had the test, but you did the take home one.
I did the take home, yeah.
Sinead went into the clinic, poor
Oh
soul,
yeah.
and it wound up in the garbage. But so I do think that that encourages people to think that an alternative, and the alternative is this mouthpiece.
Well, there's a number of reasons why they don't wear them. I mean, one, it's socially awkward. It can be, and two, sometimes they're not comfortable. Sometimes they're not. Um, they're not basically calibrated properly. I mean, so there's
Right.
a lot of reasons why they don't wear them, but a lot of people stop wearing them.
So can we come back and you'll explain yours?
Sure.
5 seconds. We're on the last segment, yes. Welcome back to the last segment of this special live edition of the Dr. Thompson Radio Show. I'm your host, Anne-Marie Cronin. We are here tonight talking with Dr. Thompson about his state-of-the-art clinic and his practice of prevention. This is our final segment, so if you have a question for the doctor on the topics we're discussing tonight, please call us at 800-859-0957. Again, that's 800-859-0957. Dr. Thompson, just to clarify a little bit about the ease with which your apparatus is so much simpler to cure or to handle sleep apnea and patients that are diagnosed with it, because so many patients don't know. They don't know about the connection between sleep apnea and cardiac disease. And then they also think as though there's only one alternative, and that's to wear the mask, which is cumbersome, and a lot of people don't follow through with it. Tell us a little bit about your apparatus.
Yeah, the official name for the apparatus is called a MAD, and MAD stands for, and it's a big word, it stands for mandibular advancement device. But what that is, the mandible is your lower jaw. And if you ever think about it, your lower jaw is the only one that moves. Your upper jaw doesn't move at all. So sometimes I'll tell patients to move their lower jaw, and they start moving their head around. I go, no, just move the bottom one today for now. The top one
Mhm.
doesn't move.
Mhm.
So what happens is it's a device that has two pieces of very healthy plastic. And again, I loved Karen's question from Northville about the plastic quality. But it has two pieces of plastic, and there's some there's many different types of these, and we look at your anatomy, and we make a decision about what type is going to be best for you. But it snaps on the top teeth and it snaps on the bottom teeth, and there's some component of it could be an elastic band, it could be a fin, it could be a piece of plastic, it could be something that causes your lower jaw to come a little bit more forward from where it would normally be if you were relaxed. And what happens when we sleep, we relax, the tissue as we age gets a little bit more flappy and flabby, and then it blocks our airway at night. And so snoring is the first indication that there's some kind of blockage, because that means there's very little space between the two pieces of tissue, and the air is making the tissue flap around. And as that tissue flaps around, it gets to be less and less, it gets to be more and more elastic. So that means it sags more, and all of a sudden it blocks the airway. So this is why we used to think it was a disease of age, but now we have even children that have enlarged tonsils and have enlarged soft palates and have problems that causes snoring and sleeping sounds. And what ends up happening, Emery, when we go to sleep, our body relaxes and then our airway gets blocked. And if our airway gets blocked, you're either going to panic to reopen it. That's called gasping. And there's a book called Gasp. It's a fantastic book to read about this process. Or you're going to choke, or you're going to make some kind of sound that somebody is going to hear and say, that's not normal. That's not normal sleeping sounds. So these appliances move the jaw into a position that allows air to get through. And so if you tried to breathe through a coffee stirrer, A coffee stirrer is just a really thin piece of plastic with a very, very small hole versus a really kind of bar straw, like even just a straw that has just a really small hole about the size and diameter of a thick piece of spaghetti. The air that you get is totally different. So sometimes you don't have to move the jaw very far forward to make a huge difference in sleeping. And so that's the idea behind that. And we have these devices can be very therapeutic. And if you have somebody who's doing well with them, they will not let you have it for one night. They will not leave home without it.
That's what you were
So,
saying over the break and when we were on
yeah.
Facebook, is that you've got a patient that you wanted to clean the device and he refused
No
to give
way.
it
They're
back.
not giving it back.
No,
Yeah.
I mean, that just goes to show you how much relief they perceive that they're getting from it.
Oh, I have
They become
people.
very dependent on it.
I hope to bring one of my friends, Don, on who will give us a live testimonial. He said the first night he put his appliance in his mouth, he never slept like that. He never remembers sleeping like that ever.
I can
Wow.
So,
imagine.
yeah. So
And they're
it's amazing.
custom made. So,
Yeah,
I
they're
mean,
very
it's
custom made. Yeah.
so it's like, it's not like you go out and buy one at the store. I mean, it's something
No,
that you have to be fitted
for
for.
sure.
And being that it is custom made for you, it's perfect because it's custom.
It's totally
And so,
custom.
and
I
then
have patients that buy two of them because they
I was about ready to ask
yeah,
you that.
because if the dog gets it or
I was,
somebody,
no,
yeah.
I thought about that. I
Yeah,
thought, I can imagine that if I were going to get one of those, I'd buy two in case you lost one.
that's
Yeah.
correct.
And also, I think for traveling and going around, I mean, I don't know how people travel around with the big CPAP machine, and
Yeah.
it just seems to me to be so archaic.
Well, it's not, that even that technology's gotten very sophisticated and quite comfortable for some people, but we have to figure out what works. And the idea is we don't want anybody walking around getting poor quality sleep, whether it's sleep hygiene, whether it's sleep apnea, whether it's, and there's other things, Anne Marie, that we could talk about called upper airway resistance syndrome. That's a big syndrome for fit young females. We have people that we look at and say, oh, they must be healthy and they must, breathe great, and they're suffocating at night. And
Hmm.
it's really affecting their long-term health. It shaves years off their lives.
Hmm.
And because they're more prone to diabetes and cardiovascular disease and many, many different diseases, aches and pains and fibromyalgia, and anybody who's having chronic headaches or having muscle aches and constant pain, these people should all be evaluated. Airway and how they breathe is a very, very important component to all of these diseases.
That's interesting. That reminds me of a friend that I have who has complained about chronic headaches, and she said MRIs and all sorts of testing done, and they find nothing. So I'd be curious to hear if she may have a sleep issue
There's no
because,
question it needs to be evaluated.
yeah.
And I'm staring at Ashley right now. So, Ashley, when are you lining up? You're next. It's fine. I'm just, I know
The
that
listening,
you're not on the air, but
the
I've got you. I got my eyes on
Yeah,
you.
the,
So
Yeah.
the listening audience can't see Ashley, but Ashley's usually taking the calls, so
I
I appreciate
Ashley's
that.
she's here, and we're staring her down
Well,
because
and
we.
speaking of calls, not to interrupt, but before we're out of time, we do have a caller that maybe
Okay,
we can
let's
fit
take
in.
it.
So we have Eric and Milford on the line. Eric, what's your question?
Yeah, doctor. Question I have is several years ago I had a sleep study, and I hadn't started snoring until, I don't know, 6 or 7 years ago. And I'm 64 years old. And anyway, the sleep study that I had, I don't think really helped me very much because I don't even think I slept. But they said that I went into REM sleep, and I was basically awake staring at the clock all night. But anyway, one of the things that I noticed is that I just can hardly breathe through my nose when I'm laying down, especially if I'm on my right side with my right side of my face on my pillow. So what I did is I tried numerous dental deals. Okay,
Yep.
and the one of them that I tried brought the bottom jaw forward a little bit.
Yep.
But what I found that was very painful for my jaw muscles, and I never got used to that one. And so I have finally I've stopped using the dental things, and I started using the kind of like a breathe right nose strip to open
Yeah.
up my nostrils, and I'm breathing way better at night. And I'm still snoring a little bit, but not nearly as bad.
Eric, I
And my
got you.
wife obviously noticed it.
Yep, I got your question. It's a great one, and I have about 50
Less than a
seconds to
minute,
answer
right,
it.
to answer.
So I can tell you that what you went through, your sleep device probably could be made a little bit more comfortable if you wanted to use that sleep device. But really what you're talking about, Eric, and the nature of this call is nasal breathing. And if you breathe through your nose and you can redirect the air through your nose, it's an amazing physiologic change for your body. You produce things that relax your blood vessels. There's numerous benefits, and there's a book called Close Your Mouth. And so we are a big proponent of lip sealing. You might know it as mouth taping, but with only a short time to answer the question, all of your listening audience should know it's one of our basic airway things that we go through first. We evaluate whether you can breathe through your nose. We want to encourage you to breathe through your nose at night and not through your mouth. We're the only mammals that open our mouths and breathe through our mouth at night. So it's a great question, Eric. We are big, strong proponents of nasal breathing. Very important.
Absolutely. Well, unfortunately, we're out of time, and that wraps it up for the Dr. Thompson radio show on 760 WJR, sponsored by Integrative Oral Medicine. I'm your host, Anne-Marie Cronin, and again, I want to thank Dr. Thompson for talking to us this evening about taking charge of our health, being proactive, and avoiding the devastating results of undiagnosed oral pathogens. Thanks also to my co-host, Siobhan Cronin. To learn more about Dr. Thompson's practice, you can reach him directly at 248-642-1000. Again, that's 248-642-1000, or by visiting him on the web at ioralmed.com. Again, that's ioralmed.com. We hope you enjoyed this special show and that you become more informed about oral health and its impact on the major diseases of our time. Good night, and thank you for listening. Be well.
Opinions heard in the preceding program are those of the host and guests and not those of Cumulus Media or WJR Radio.
Gifting
Ashley's
season
sitting over
is
there, and
here.
I'm looking
It's
at her
not
and
too early to
thinking,
find the perfect
you had a headache
presents
the other
like the
day.
styles every guy loves from Untuck It. Get ahead of your holiday
You did?
shopping
But
with
yeah,
wrinkle-free
Z gets
shirts, long-sleeve
chronic
polos,
headache all
cozy
the time.
sweaters.
That's
and
the cellist.
Untuck It shirts are designed to be worn untucked, so they help guys to look sharp and feel casual. That's why he'll love unwrapping one of
Ashley, if
our
you want to do
iconic
that, you come
shirts
to the
this
office
year.
and
Now's
Joe
the
will
time
hook
to
you
beat the
up
rush
and we'll
and
get
find
you.
the perfect shirt at Untuck